We are really having a group of people that is so talented, and they're working round the clock. And for that reason, I really would wish that we could report exactly what's happened, how well we're doing under quite adverse circumstances. But we're doing really well.
While political leaders are choosing to send reassuring messages to their people,
the risk to any average American is low from the novel coronavirus.
We could have more sad news, but the American people should know the risk for the average American remains low.
Scientists feel a sense of urgency that the opportunity to control COVID-19 is slipping away as the number of cases worldwide is only increasing. One of these scientists, Principal Deputy Director of the CDC, Anne Schuchat, chose a cautionary tone in speaking to the public.
However, current global circumstances suggest it's likely that this virus will cause a pandemic. In that case, risk assessment would be different, and new strategies tailored to local circumstances would need to be implemented to blunt the impact of the disease and further slow the spread of the virus.
Other experts have gone further to say that it is not a question of if COVID-19 will spread throughout the United States, but when.
But we also know that number of known cases is certainly an underestimate because many people have never been tested who might have the virus.
These mixed messages can be very confusing for the American public, which is left unsure about whether they can go about their daily lives or should stay quarantined at home. The key to the disconnect boils down to a disagreement over whether COVID-19 can be contained. In the early days of the outbreak, when China sealed the Hubei province and the U.S. banned flights from China, it seemed possible to contain the disease. However, as cases continue to mushroom around the globe, more infected people are flying into the United States from countries like South Korea, Italy, and Iran, where cases of the disease are increasing daily. Temperature screenings at airports might not be identifying infected people who are simply not showing signs of a fever. Under these circumstances, containing COVID-19 may no longer be possible, both in the U.S. and around the world.
The average American in your daily life, the risk of getting the novel coronavirus is very low. But if you are around individuals who have the novel coronavirus, the risk obviously is higher. And that's why the efforts we're taking with the state of Washington and with Santa Clara County and elsewhere in the country are around what's called community mitigation.
The tension between political leadership and scientific experts on how best to handle cases is leading to inconsistency and confusion.
Working very hard with the CDC, with everybody on a subject that has become a very big subject. Our country's doing very well. Our professionals are doing really an incredible job.
When U.S. passengers were evacuated from the Diamond Princess cruise ship, the CDC and the State Department disagreed on how to transport them. The CDC advised not to put infected passengers on the same flight as non-infected passengers, but the State Department decided to keep everyone on the same flight. State's argument was that all passengers were going to be quarantined for 14 days anyway. During a public health crisis, health officials are used to walking a fine line between preparedness and panic.
We're concerned that countries' abilities to respond are being compromised by the severe and increasing disruption to the global supply of personal protective equipment caused by rising demand, hoarding, and misuse.
What's difficult about keeping people informed about COVID-19 is that experts still don't know critical pieces of scientific information.
Obvious concern to everyone is the level of severity and lethality of this virus, and that is one of the biggest unknowns.
Still, transparency about the uncertainty and clarity about why recommendations or advice are being issued are the strongest tools for alleviating confusion. With better scientific understanding about how the virus works should also come more cohesive advice from health officials. That includes specific examples of what people can and should do to protect their health.